Hello everyone. Welcome in today's nursing webinar by Yashoda Hospitals. Myself Shanti Bhattacharya, the Vice President Nursing. We will now have online quiz session on OBG and Gynaec nursing. I'm sure every contestant must be very delighted and excited to be participating in today's quiz session. Please do download the Kahoot app before the quiz begins. It is Kahoot. Do enter your game pin, which is displaying on the screen. It will soon be providing the access to all of you all. And you can copy that and it will give you the access. Now, guess who is our quiz master today? None other, the very dynamic nurse educator, Miss Anusha, will be driving the quiz session today. And welcome, Anusha. And I wish all the contestants the very good luck for the quiz to happen. Thank you, and over to you, Anusha.
Thank you, ma'am. Good evening, everybody. Welcome to the 6th Nursing Pro Quiz by Yashoda Hospitals. Hope everybody can see the game pin, that is 393771. So a few more are adding. Let's wait for 2 minutes. So we have many people joined here like Chandana, Bhavana, Chittu, Satyavati, Shaino, Prema, Anam, Chaitu, Ammu, Sandy, Sunny, so many. So we have total 88 participants today as of now. So let's move on to the webinar. So this quiz is followed by 4 rounds. Each round consists of 3 questions. Okay, so let's start our quiz with round 1, that is pre-eclampsia and its nursing management. The first question, what stage of pregnancy does the nurse know pre-eclampsia tends to occur? A, before 10 weeks, B, before 20 weeks, C, in the 3rd trimester and postpartum, D, in the 1st and 2nd trimester. The fastest hand first. Wow, we have received 70 responses now. The correct answer is B, after 20 weeks. So we see the scoreboard here. Monu Sheikh is leading the scoreboard, and next is Amaravati, and the 3rd position is Sneha. So the right answer here is B, after 20 weeks only. So pre-eclampsia usually tends to occur only after 20 weeks of gestation because of the fetal placental disorders as well as pre-existing maternal diseases. So please remember that the fastest finger will be scoring high. Coming to the second question, if magnesium sulfate is started on pre-eclampsia patient, the most preferred antidote will be A, acetylcysteine, B, oxytocin, C, calcium carbonate, and D, calcium gluconate. 8 seconds more. So far we have received 47 responses. Fastest finger the first. Excellent. We have received 83 responses as of now. The right answer is D, calcium gluconate. Let's see, 31 people have answered it correctly. So let's see the scoreboard. Wow. Lechu is leading it, followed by Nirmala, Anju, Hana, and Amaravati. You have many more questions to go. Please be very quick. The answer is calcium gluconate. The antidote of magnesium sulfate is calcium gluconate, to be used when magnesium toxicity occurs. That is when the magnesium level is more than 12 milligrams per deciliter. Next, coming to the 3rd question. You have 2 options. A primary gravida patient is currently 34 weeks. Which findings could indicate the development of pre-eclampsia? You can check multiple answers. A, high blood pressure more than 140 by 100, 3+ dipstick urine protein, 1 hour glucose tolerance test, and D is less than 300 mg per deciliter, 24-hour urine protein. Wow, 86 people have given the right answer, but I think 7 people have missed to give the second option. So again, we see the scoreboard. Lechu is still leading, followed by Anju, Siri, Nirmala, and Hana. Let's move on to the answer, where the correct answer is A and C, which is high blood pressure more than 140 by 100 mm of Hg and 3+ dipstick urine protein. So we have completed our round 1 of quiz. Let's enter into the round 2. It is all about iron deficiency anemia in pregnancy. So let's not delay and move on. The first question in round 2 is, which of the following age groups would be inappropriate to monitor for iron deficiency anemia? A, pregnant women. B, school-age children. C, toddlers. D, adolescents. Fastest finger first. As of now, we have received 60 answers. Oh, it's very fast. So total, we have now 95 people, 104, 107, great, 112. So out of which only 13 people have answered it correctly, that is school-age children. So let's see who's on the lead. Lechu, wow, very good. Ammu, Vani, Anju, and Siri. So let's see the answer. It's school-age children. Iron deficiency anemia is not prevalent, is more prevalent in school-age children because the stage is not a period of rapid growth. Let's move to the next question. Which type of anemia is common during pregnancy? Whether it is iron deficiency, folic acid, nutritional deficiency, or vitamin B12. Wow, you are all answering very fast. We have received already 90+ responses as of now. Excellent. 110 responses. Wow, it's crossing 120. Great. So the correct answer is iron deficiency anemia. Let's see who's leading. Yeah, Lechu, Ammu, Anju, Nirmala, and Amravati. So don't be discouraged. I have already told you that the fastest finger will be the first. So the answer is iron deficiency anemia because the blood volume increases during pregnancy, so as the iron demands. So that is why there is a more prevalence of iron deficiency anemia in the pregnant woman. Next, we have the true or false. Can anemia during pregnancy causes miscarriage? True or false? You guys are amazing. You are very fast in answering the questions. Wow, 99, 100. It's running too fast. It's been already 120 responses as of now. Okay, let's see the answer. It's false. I think most of you have thought it's true. No, it's false. So let's see the scoreboard. Yeah, Amal is now crossing Lechu. Next by Ammu, Anju, and Chaitu. So the answer is false because anemia during pregnancy directly does not cause miscarriage, but severe anemia can cause pregnancy complications like low birth weight of the baby and so on. Okay. So let's move on to the next question. That is round 3, which include the questions of C-section, also known as cesarean section, and post-operative care of the mother. So the first question in round 3 is, a woman underwent cesarean section is yet to discharge. The nurse instructs the patients to notify the doctor if she develops A, drainage at the surgical site, B, decrease in lochia, C, no bowel movement since 2 days, D, pain at the incision site. Fastest finger first. So far we have received 70, 80. Wow, it's too fast. 110, 112. Very good. Yes, 39 people have answered correctly that the drainage at the surgical site. Let's look at the scoreboard. Who's leading? Wow, Chaitu has climbed up very fast. Next, Hana, Anusha, Amal, and MS. Very good, great job. So the answer is drainage at the surgical site because this may cause infection at the site of incision. So let's move on to the next question. It is, what is the most important responsibility of the nursing team before starting a surgery? Yes, assessing the patient for hygiene, administer medications, inserting urinary catheter, and ensuring the consent is obtained. I think every option is looking the important task. Let's see who will answer appropriately. Wow, we have received 120, 122 answers right now. Wow, 88 people have answered correctly. It's ensuring the consent is obtained. So who's leading? Yeah, Chaito is still maintaining his leadership in the scoreboard, followed by Amal, Anusha, Hannah, and NS. Let's see why. Informed consent is most important responsibility before the surgery, because without informed consent, we cannot perform the surgery. After informed consent, you can have rest of the things like ensuring hygiene and all. Right. So let's move on to the next question. Which of the following interventions would be most helpful to assist patient to void after the cesarean birth? Okay, this is the most common complaint. Withholding prescribed antibiotics, running water from the tap with the patient's hearing distance, letting the patient to void every 4 hours, pour cold water over the perineal area. Wow, you're very fast. It's amazing. So we have received 112 responses. 19 people have answered correctly. That is running water from the tap with the patient's hearing distance. So who's leading? Hannah. Wow. Leading with 4,261 points, followed by Chaitu, Amal, Anusha, and NS. So let's see the answer. So urinary elimination can be stimulated when the patient hears running water, so he or she can pass urine. So this is end of round 3. Let's move on to round 4, which is the last round. So hope everybody are enjoying the quiz. And again, please remember, this is the last round to score the maximum points. Be very fast in answering the questions. The fastest finger is the first finger. Okay. So round 4, it's all about PCOD and PCOS, the myths and facts associated with the PCOS. So the first question in round 4 is, does PCOS cause weight gain? Is it a myth or a fact? Very good. We have received 50 responses so far. 12 seconds remaining. Yes. So it's very fast answering. Great job, everyone. So far we have received 128, 129, 130, 131 answers, out of which 1 or 2 say it's fact. Yes, PCOS do cause weight gain in females. So who's leading? Wow, Chaitanya has again grabbed the leaderboard, followed by Amal, NS, Sri, and Chitra. PCOS women are more likely to be overweight than a woman without this PCOS condition. It may be because of the hormonal changes. Next, move on to the next question. Women suffering from PCOS cannot conceive. What do you think? Is it a myth or is it a fact? Great, 77 answers so far, and you have only 10 seconds, 8, 7, 6, 5, 4, wow, 120 answers, 2, 1, and here goes the answer. It's a myth. Let's look at the scoreboard. So who's leading? Wow, Chaitu is still leading with 5,720 points, followed by NS, Amal, Sri, and Chitra. So let's move on to the next question, which is the last question of this quiz. Who will be leading the leaderboard with this question? A single question can change the entire leaderboard. So please be prepared. Let's go to the last question. Before that, we will have a answer for this. Women with PCOS or PCODs may have difficulties to conceive, but if she follows a regular diet, exercise, and managing her stress levels, she can increase her chances of getting pregnant. So it is a myth that they cannot conceive with PCOS. Now comes our last question. Women suffering from PCODs are always on birth or oral contraceptive pills. Is it fact or a myth? Wow, we are too fast. So the time is running out. 9, 8, 7, and the answers are also been very high, like 118, 125, wow, 135, 136 people have answered. Yes, it is a myth. 96 people have answered that it is a myth. Contraceptive pills only reduces the symptoms of PCOS, such as hirsutism, but not all the problems. There are a wide variety of medications which are helping the people in PCOS. So it is a myth that we only use contraceptive pills. So this is the end of our quiz now. We have completed all our questions. So let's see our leaderboard now. So who's on the podium? Third place goes to Amal. Wow, congratulations, Amal. Second place, Shri. And the first place is none other than Chaitu. Great. Congratulations, everyone who have taken a part in this quiz. Thank you for your active and enthusiastic participation.
Thank you, Anusha. Indeed, it was a very great contribution from your end. And I would love to wish our contestant who is Chaitu, Shri and Amal, if you all are from our unit, we would always like to come and compliment it later. And that was amazing performance actually. And I myself, I was enjoying and felt like to participate, but I can't. So, one small announcement we would like to do is now July also we will be running the ortho series, like orthopedic nursing series. If contestants or the nursing viewers have any kind of change or any patterns to be changed, you can always get back to us. This July month, we will be again coming with ortho series. Until then, thank you. Be safe and just get healthy and happy. Thank you.
Thank you, ma'am.